searched the world over and thought I found true love. You met an AI and poof, you was gone.
Hey, welcome. This is You Teach the Machines. I am Jeff Pennington, joined by my daughter,
Mary Jane Pennington.
And the two of us are joined by an esteemed guest. Phil, would you please introduce yourself?
Hey, I'm Philip Hagedorn. I am a pediatrician and the Chief Health Informatics Officer at Cincinnati Children's Hospital.
And Phil has been a close colleague of mine for a long time. We're fellow travelers in philosophy and values, and I'm really excited that you're joining us today.
Well, thanks for having me. I appreciate it.
Yeah.
It's a neat opportunity.
This was prompted because you've had a few experiences as an educator. As you know, on this podcast, we talk a lot about the shift in how people learn, students, how people learn, how educators educate, from the change in the zeitgeist, the landscape from the introduction of ChatGPT in late 22, early 23, something that nobody really asked for, but it just is kind of happening. And we're all working to make the best of it. I think maybe one thing to do here would be, Mary Jane, do you have friends, recent graduate friends, people are still students who are looking to go to nursing school, med school, enter the health professions?
Yeah, definitely.
What do you think? What do you think they're sort of thinking about right now? Like, what's top of mind for them? Are they worried about MCATs? Are they worried about admissions?
Yeah, so I have a couple friends actually who are taking off time to study for the MCAT, because it felt like a big task to study and perform well in the middle of a college semester. I think because admissions are pretty competitive, like taking a year just to take the MCAT and maybe work a part-time job at the same time is a move that I've seen a lot of peers making when they're looking to go to med school. And
Phil, you're kind of on the other side of that equation in that you're working with residents and fellows at times. Is that correct?
Yeah, and medical students. So, and we've got, even this summer, we've got a number of undergrads who come and partake in summer programs here. I was just standing up in front of them last week, our undergrads, and sort of talking a little bit about my job and all the cool stuff I get to do, but also some of the, challenges we face in where we're trying to go with combining healthcare and safety and quality and research with technology. So,
right.
It's a fun training environment, oftentimes, regardless of what I'm doing and what hat I'm wearing.
Got it. Mm-hmm. Phil, would you mind sharing any anecdotes or sort of observations you're making about a shift that you're seeing with these students that you work with as AI tools become either just like a default, something that they're used to using already, or are newly engaging with?
Yeah, it is interesting sort of as I work with learners across the spectrum and sort of in different domains, there's been a shift for sure in, I almost want to call it like the reflex of where you go for an answer. In some cases, I'll just say sort of across the board, right? That reflex is towards tools that leverage large language models. Looking at Perplexity or asking ChatGPT, or instead of using the returns search results of Google, using the AI summarization. And I think for sure that's something. It's sort of the reflex used to be different with respect to where you go first when you have a question, and how you seek out that answer, and even sort of the difference in sort of acceptance of that answer, I think has been interesting to watch over the last couple of years.
Yeah, I think that's huge. We've talked a lot about kind of how undergrad is like learning how to learn, learning how to think critically, and having the reflex be consult AI and immediately accept whatever answer you see, as opposed to having to think critically and sort through maybe lots of different scientific papers. I wonder if you have any concept or idea. I think it's too early to tell now how like that lack of objectivity and critical thinking and the ability to like have a barrier between the search and the answer where you think about the source. I wonder if you've noticed that the lack of that barrier, because it just spits out an answer. You don't have to do any thinking to get from your question to the answer.
Yeah, it is interesting. I mean, I think I confront this sometimes in sort of even in clinical practice, where I encounter somebody, whether that's, a patient, a parent, or a trainee, who's gone to a generative AI tool to seek an answer. And oftentimes my response to them when sort of I see them use that tool or I hear them talk about using that tool, my initial response is, are you appropriately equipped to evaluate the validity, the accuracy of that answer in some form or fashion? And oftentimes the answer is no.
Right.
And that, that doesn't, there's something to be said about sort of the ability of those tools to give us correct answers. And there's yet another thing to be said for what I think you're voicing, which is sort of our own capacity to arrive at the answer using, the appropriate sources, the right evidence, and sort of the right sort of objective and logical approach, right? Those are different things. Getting the right answer and the exercise and the ability to get there are different things.
Yeah, I think we're touching on something important here that Mary Jane, you brought up, that is the friction of the process. So going from question to answer, with critical thinking being, really overcoming some friction and resolving different points of view, different sources. And that is friction. That's like, okay, well, that's not necessarily a comfortable place to be when you need the answer. And we've talked about that being fine when it's, hey, tell me about, the campground in the state park versus, hey, tell me about the rash and the fever.
And we've talked about this as like training your brain like a muscle. Like you have like that friction, that resistance, that critical thinking is sort of an exercise in like in the liberal arts learning model. You're kind of just learning how to learn, and you have to work your brain in lots of practice ways so that when it really matters, your brain's ready to go. And if we start to lose that, we're not training against the friction of critical thinking when we're identifying information from sources. Then when it really matters, is the reflex just going to be to take whatever answer you get at face value?
What do you mean by sources?
Like when you are doing research without the use of a large language model and consulting maybe scientific papers, maybe.
So you've got a bunch of hits from your search.
Yes.
Whether that be in PubMed and you're looking at a list of papers, or that be on Google and you're looking at a list of, WebMD summaries of.
And we're taught how to evaluate sources. Like there are entire class periods in almost every scientific class I took dedicated to evaluating a source. Like what year was it from? Look at some other papers by the authors. Try and find maybe some peer review, things like this, where you really have to think about where your information is coming from. That goes away with a large language model.
So Phil, could you tell us a bit about the tried and true accepted process when you're, and this again, layperson here, but I'm thinking that maybe the concept or the exercise of a differential diagnosis would apply. Like, you have a question, what's going on with this patient, and I got to get to an answer. Like, what are you taught as a med student? What do you learn and refine and hone as a practitioner?
I'll say a lot of this has shifted, frankly, in terms of training and content and that kind of stuff, or maybe even just execution. Right? What our job as physicians to do is really to sort of dive into a patient's story and learn to extract the critical elements that either fit that patient's story into a disease script that's really well described and known, or to identify the anomalous elements that raise flags and sort of indicate that we need to think differently. It's sort of the difference between type 1 and type 2 thinking, or fast and slow, right? As popularized by Kahneman, the idea that there are some heuristics and shortcuts we can take based on the overarching prevalence and sort of commonality of certain diseases, right? When it's flu season, if someone shows up with a cough and a runny nose and a fever, and there are no distinguishing factors, then by and large, we're looking at flu. But if that same patient shows up in a different season and has other physical exam findings, or other sort of anomalous historical factors, then you have to say, okay, there's something wrong here. It doesn't fit, and I need to slow down and think differently and start to evaluate other resources that might help me identify why this is anomalous, how it's anomalous, and how to seek other sort of objective evidence to zero in on an answer for a diagnosis. So that's, I think, a long-winded answer, but maybe helpful in light of this conversation.
Super helpful. So when you're thinking about a large language model pulling information, if you are a med student and maybe there's like a case study and you're putting in symptoms into a large language model, this is kind of a question for both of you because I don't know the nature of large large language models. Can ChatGPT take into account like temporal, seasonal, location data? Like, does it know when and where you are when you put in a query? Or Phil?
So I don't know that necessarily that sort of metadata gets accounted for in the prompt itself, but you could presumably build it into sort of how you prompt the model. But Jeff, are you aware of any models that take that in sort of automatically into account?
Any models? So I'll say I'm sure there are generative models, whether they be LLM or otherwise, that are aware of time of year, in large part because ultimately where the market's headed is they're going to try and sell you something.
Right.
And they want to know, is it summer, winter, fall, spring, Christmas, that kind of thing.
So
that's a little bit of cynicism always leaks through. But there's an interesting parallel. So Phil, you share that a big part of your job as a physician is to pull the story out from the patient.
Right.
And to ask questions and to get to the point where there's like diminishing returns on that, and you're converging on like some certainty about that you have the whole story, what that story is indicating in terms of the patient's condition, background. You develop some theories along the way that may help you ask new and different questions. And so
if you're using critical thinking in concert with a large language model and you're giving it all of the background information that's necessary and you're continuously prompting and trying to hone in on the answer, then maybe you're still encountering that friction we were talking about when you're looking for a source, as opposed to just this patient has a runny nose and a fever and then taking whatever answer it gives you at face value.
Yeah. Well, and you used an interesting metaphor earlier, Mary Jane, when you described muscle, right? Your sort of thought process, your critical thinking is a muscle. And I think one of my Substacks that I subscribe to had a really interesting article today. It's called AI Snake Oil, and the premise of the article is AI slowing science down. And in it, they used a metaphor that I loved, and they essentially sort of said some of what we're facing it's the same dynamic of bringing a forklift to the gym and using a forklift to lift the weights, right? We don't go to the gym to make weights go up and down. We go to the gym to exercise and to strengthen our bodies. And the presumption of sort of bringing a tool there to do it for you really obviates the need to go to the gym in the first place, right? You're sort of defeating the purpose.
Yeah.
So I love that sort of way of thinking through this is how do we equip ourselves as human beings to do this? Because one, there's virtue in that in its own right. And two, it helps us to more thoughtfully and skillfully apply the tools when and where we need them.
Maybe in the future, in the same way that we've had to replace physical labor with going to the gym, we'll have to just do like puzzles and mind games on the side because the AI is like automating knowledge work the same way that machines are automating physical labor.
You're always going apocalyptic on me.
Walker had some.
We are also joined by my son Walker, Mary Jane's brother Walker, who has a question or a comment.
Hi. When you were talking about large language models being aware of like the temperature, the season, or whatever the current state of your location geographically, would they be able to develop an answer to that themselves based off inputs they're receiving from however many entries they're getting from users?
If a lot of people are Googling flu symptoms.
Oh, heck yeah.
Okay.
Yeah.
Good question.
Thank you.
There's a famous. Go ahead, Phil.
Go ahead. No, you were going to mention it, Jeff.
Oh, no. You're the guest.
Nerds.
Go.
Well, I don't want to steal your thunder.
No.
There's an existing approach to that actually in sort of the old-fashioned search engine where Google was able to predict seasonal flu patterns based on folks getting in and searching on symptoms alone. I imagine that's a much more robust feature set now that we have more sophisticated tools to bring to that problem. But yeah, that's it. It's a great comment that already intersects with the work that's been done.
I have a question that I want to pose to both of you, both having worked in similar roles in research, in healthcare, in administration and management, and managing employees. So we've talked a lot about how this is kind of being put on educators to decide how to regulate the use of AI, to decide how to implement AI usage in their classrooms, to figure out how to best guide students into using it in a way that they maybe continue to build their muscle brain. I'm curious, as an employer who is managing employees, how have both of you addressed coaching your employees on how to use AI in the work that they're doing? Have you considered it in the same way that an educator has to figure out how to empower employees to use it while still maintaining that critical thinking and the ability to avoid the reflex or the dependence on it? As a new employee on the job market, I'm also speaking for my fellow 20-somethings who are probably curious as to how some big employers might feel about their new employees using AI in their work.
Yeah, that's a great question. It's a wonderful question because it really does sort of speak to what's happening in the workforce right now. I'll say oftentimes, we can think about these tools in a number of different ways. One, we can think about them as sort of a path to a quick and easy answer. The other ways that we can think about these tools are like a coach or, like a really well-equipped critic to help us understand how something we've written is off base based on our, goals and objectives for a message or, a one-pager for a project or things like that. I actually just had a conversation right before I hopped on this call with a mentee who they're trying to write a cover letter. They said, I have such a hard time hyping myself up, right, in writing. That's not how I'm oriented. It's not how I'm directed. It's not something that's sort of internally motivating to me. My response was, well, this actually is a great opportunity to use a large language model to say, hey, here's my CV, here's my bio sketch, write an enthusiastic, a letter about myself in this role that I'd like to apply for, and use that output not as this sort of rote shortcut to a letter that creates what you wanted to create, but actually is a way to reflect back to yourself how you can write about yourself more effectively. Because I kind of feel the same way. I don't want to do that, but I have to get better at that if I'm going to advocate for things that I think are important for my team, for my work. That's a skill that I need to develop. You can use these tools in creative ways to that end.
In my work, so much of it is of the job is thoroughly understanding the problem to be solved, the opportunity to bring technology to bear to do something new, different, better, faster in biomedical data science. And the view is when it comes to the coding assistant, AI tools, SQL, structured query language, use the heck out of it, because the point isn't the code, the point is the problem that the code solves. Let's get to that faster and move on to the next problem. That being said, that is already starting to undermine salary and the perception of the need for person hours, right? So there's some argument. Prove to me you can't do that with AI before we even talk about hiring somebody. Okay. Yeah. So go ahead, MJ.
I have a follow-up question. What is your advice to undergraduate students or 20-somethings like me who are just now entering the workforce if we encounter a boss or a mentor who refuses to use AI and thinks that we should not use it in any of our work? What's a good way to go about justifying the usage of AI? My dad just took a deep breath.
Yeah.
So did Phil.
Yeah, I did. Yeah. I think that's interesting. I mean, that really does relate to the environment you find yourself in and sort of the coaching and mentorship you're going to get. Because I think that's sort of a head in sand approach to management and mentorship, pretending that these things don't exist and that we shouldn't consider them in how we do our work and, how we develop or as individuals. So I'd have to stew on that for a while, but I think the fundamental argument really is that these aren't going away, that they're only going to become more ubiquitous with respect to, penetrance and use in the broader workplace. And there's a really good argument to be made that we should think carefully and strategically about when and how and where we use them, how we evaluate their utility, and that's, to me, a much better approach than just ignoring their existence or pretending like they're not going to be impactful, because they already are.
I'm going to dodge that question and we're going to end on that. I actually have some thoughts that we'll come back to, MJ, you and I, and maybe with Phil back on at a time in the future. Because this isn't just, slide rule to calculator or, encyclopedia to internet. It's different than that, because there's serious implications for original thought, creativity, that sort of thing. But we're going to wrap up, and this has been a great discussion. Very grateful, Phil, that you joined us.
Thank you so much for joining us. Yeah.
And Walker too, that you chimed in. Mary Jane, thanks as always. And we're out.
All right. Well, thanks, guys. It was great to meet you, Mary Jane, and Walker, and thanks, Jeff. I appreciate it. Good to talk.
Have a good one.
Ones and zeros, vectors and scalars. What do you see in that machine? I gave you my heart, my warmth, and Snapchat. You chose a robot, now I'm alone. And poof, you was gone.